Demographic aging moves with the momentum of a glacier, quietly reshaping every social and economic structure in its path over decades. The UN Population Division identifies this shift as one of the most critical social transformations of our time, affecting nearly every sector of global society. Malaysia is currently accelerating toward aging nation status, a transition already placing immense pressure on local infrastructure and the active workforce. Data shows a specific trajectory. As birth rates decline, the elderly population climbs steadily toward the critical 15% threshold by 2035. This demographic math creates the sandwich generation, middle-aged adults forced to raise their own children while simultaneously managing the care of their parents on a single household income. Culturally, the weight of filial piety turns this care into a profound moral obligation, often requiring caregivers to make extreme personal and financial sacrifices. Mandated elder care has deep historical roots, originating from systems designed to manage extreme poverty and the marginalized long before the modern welfare state. That debate persists in Malaysia, where politicians frequently advocate for a Maintenance of Parents Act, forcing adult children to provide for their parents. Fulfilling this duty in today's reality forces families into a brutal trade-off between moral obligation and their own financial survival. Many families rely on a parent's existing medical insurance, but coverage often terminates entirely, or premiums spike to unaffordable levels once they reach age 65. Without coverage, families often attempt DIY caregiving. Statistically, the average family caregiver now spends 24 hours every week purely on care duties. Those hours are filled with demanding physical tasks, from basic household chores to complex personal care, feeding routines, and medication tracking. This burden hits families already squeezed by record inflation and, for many, lingering student loan debt. To manage those 24 hours of care, 27% of working caregivers drop to part-time employment, reducing household income. The impact scales. 16% turn down promotions, and another 16% stop working entirely to handle the logistical load. This constant logistical juggling and physical exhaustion triggers a cycle of caregiver burnout, often manifesting as chronic anxiety and depression. Relying purely on sweat equity to care for a declining parent is mathematically and physically unsustainable for the modern working family. Most families eventually reach a tipping point where DIY home care becomes unsafe, particularly when a parent requires advanced mobility assistance or specialized wound care. At this stage, families look to JKM registered care centers, which operate in the Care Centers Act 1993. These are legally classified as wellness centers. They provide basic accommodation and meals, but have no mandate to employ full-time medical staff. Families using these centers must pay separate out-of-pocket costs for visiting doctors or emergency medical transport when complications arise. Because of their wellness classification, JKM centers trigger a mandatory 8% sales and service tax on every bill. On a base fee of 3,500 ringgit per month, that 8% levy adds an annual tax penalty of over 3,300 ringgit. The JKM welfare model relieves the daily physical burden of caregiving, but it introduces hidden medical gaps and an unexpected tax burden for the family. The alternative is an MOH licensed nursing home, governed under the Private Healthcare Facilities Act 1998. These facilities face stringent medical mandates, requiring full-time doctors, registered nurses, and hospital-grade safety standards. This higher clinical standard creates a significant financial advantage. MOH facilities are completely SST exempt for Malaysian citizens. Comparing total annual costs, a JKM center exceeds 46,000 ringgit with tax. An MOH center, with doctors and zero SST, costs 45,000 ringgit. Over 5 years, families in JKM centers lose more than 16,800 ringgit to this service tax penalty. However, availability is a challenge. There are only 19 MOH licensed nursing homes nationwide, compared to nearly 500 JKM registered centers. This structural imbalance reflects a legislative delay in addressing the tax divide currently trapping families in the welfare bracket. The irony is striking. Choosing the facility with higher clinical standards paradoxically protects your retirement savings from double taxation. These deeply complex logistical problems only become manageable when you carefully filter them down into a single, clear path forward. Choosing a path requires you to strictly map your parents' medical needs against your own financial and time capacity. If a parent only needs light assistance and the family has highly flexible hours, DIY home care remains a viable starting point. But if daily physical lifting, wound care, or complex medication management is required, you must transition to institutional care immediately. Remember that government tax relief for nursing homes is severely capped and covers barely 2 months of actual care costs. Ask every facility director if they hold a Ministry of Health medical license or a JKM welfare registration. Follow up by asking explicitly if Malaysian citizens are charged the 8% SST on their specific services. Fulfilling your duty to your parents means making the strategic decisions that prioritize their clinical safety while ensuring your own family's financial survival.